A little bit about some of the issues that relate to COVID-19. In the first part, will take about 15 minutes or less. I'm just going to read some parts from this very, very good article that I got the other day. And they're talking about some aspects about COVID, which I thought were explained very, very nicely. So I'm just going to read some of this to you. So this is from a physician who's also an epidemiologist, and he says, the goal today is to present the facts about how deadly COVID-19 actually is. The second, he wants to present facts of like who is at risk for COVID, and third, to present some facts on how deadly the widespread lockdowns have been, and fourth, to recommend a shift in policy. So the first part is looking at COVID-19 fatality rate. So in discussing the deadliness of COVID, we need to distinguish COVID cases from COVID infections. And it's very important that you can get that difference because it's a critical thing. So he says that we've heard much this year about the case fatality rate of COVID. And in early March, the case fatality rate in the United States was roughly 3%. That's nearly 3 out of every 100 people who are identified as cases of COVID died from it. Now, compare that to today when the fatality rate of COVID is known to be less than 0.5%. And why this big shift is because what originally happened was that back in March, what they did was 3% of the people who got COVID, they died from it. Okay, that's the 3%. But the people who made up these numbers were wrong by at least one order of magnitude, because the true COVID fatality rate is much closer towards 0.2%. And the reason for the highly inaccurate early estimates was pretty straightforward. So in early March, when all of this started, they were not identifying all the people who actually had COVID. So case fatality rate is a number where you take the number of people who died from COVID divided by the total number of confirmed cases. And the emphasis is on the confirmed cases. But to obtain an accurate fatality rate, what you really need to do is look at in the denominator all the people who have been infected by COVID rather than what was confirmed. Okay? So back in March, they only identified the people who were sick, went to the hospital. But as we now know, the majority of people who are infected by COVID usually have mild symptoms or they don't have any symptoms at all. And these people were not identified in the early days. So therefore, you have this very misleading high fatality rate. So how do you actually get an accurate fatality rate? So to use a technical term, you test for seroprevalence. In other words, we test to find out how many people have evidence in their bloodstream of having had COVID. So with viruses, that's actually not hard to do. So anybody, for instance, who's ever had chickenpox, you still have that virus in you, it stays in the body forever. COVID is different though, because it is like all the other coronaviruses. It doesn't stay in the body. Eventually, it leaves the body. So someone who is infected with COVID and then clears it, they'll be immune from the COVID, but it won't be living in them. So in order to test for that, because you can't actually test for the actual virus because it's gone, you got to test for antibodies or other evidence that someone had the infection. And what we now know also is that even antibodies, they will fade over time. So testing for them still results in an underestimate of total infections. So this particular physician who did this article ran a series of tests using antibody tests in Santa Clara County in California. And at the time when he did the test, there were 1,000 COVID cases that had been identified. But when they did their antibody screening test, they identified over 50,000 people who had been infected. So there were 50 times more infections than what were confirmed or identified. So And that's very important because the fatality rate then is not 3%, but it's closer to 0.2%. So it's not 3 in 100, it's more like 2 in 1,000. So this particular way of evaluating using antibody screening was validated. There's like 100 other places in the world where they did similar type testing, and they all pretty much came up with the same. The median was about roughly 0.2%. A good point is made. Now, in some places, the fatality rate was higher, like in New York City, it ended up being more like 0.5%. In some places, it was actually a lot lower. The rate in Idaho was 0.13%. And what this variation shows is that the fatality rate isn't simply a function of how deadly the virus is, it's also a function of who gets infected, it's a function of the quality healthcare system, and other factors. The bottom line is that the COVID fatality rate worldwide in general is going to be about 0.2%. So the single most important fact about this pandemic is that the virus is not equally dangerous for everybody. Okay, it does still seem to be a common perception that COVID is equally dangerous to everybody, but this is not at all true. Well, we know there's a 1,000-fold difference between the mortality rate in older people, that is 70 and up, versus the mortality rate in children, for instance. So, in fact, that for young children, what has now been shown is that this disease, COVID-19, is way less dangerous than the seasonal flu. In fact, more children in the United States have died from the flu this year than from COVID-19 by a factor of 2 or 3. That's very significant. So, but COVID, while it's not deadly for children, for older people, it is much more deadly than the flu. So there's this huge difference now, but we need to distinguish between the danger of COVID in the young and the danger of COVID in the old. So we'll take a look at some of those issues and some of those concerns. Now, I don't know this, and I will tell you right now, I don't necessarily agree with everything that this particular physician wrote, but he has a lot of good points. And he's talking about the lockdowns, the widespread lockdowns that have been adopted. They're actually unprecedented. Lockdowns have never been tried before as a method of disease control. And the original plan of the lockdowns, this was not part of the original plan, having these lockdowns. The initial rationale for the lockdowns was that they wanted to slow down the spread of the disease only so the hospitals wouldn't get overwhelmed by cases. Okay. Obviously, there have been a lot of issues because of the lockdowns. One is that people stop bringing their children in for immunizations against diseases like diphtheria, pertussis, polio. And that's because of the media, they were led to fear COVID more than they feared these other childhood deadly diseases. It wasn't only true in the United States. 80 million children worldwide are now at risk of these diseases. All these diseases that we used to immunize against and protect. There's large numbers of Americans who, even though you have cancer and they need chemotherapy, they didn't come in for treatment because they're more afraid of COVID than they were of cancer. Other people have skipped recommended cancer screenings, and what we're starting to see in the national data is an increase in cancer and cancer deaths because of this. We're also going to see a higher rate of people dying from diabetes because they missed their diabetic monitoring. And one of the most scary parts is the issue with mental health problems. So in June of this year, the CDC survey found that 1 in 4 young adults between the ages of 18 and 24 seriously considered suicide. Human beings are not, after all, designed to live alone. We're meant to be in company with one another. Therefore, it's not unsurprising that the lockdowns have had the psychological effect that they've had, especially in the younger people. So what happens from now? So we know that with time, you're going to get immunity building up in the population. And the risk of infection to all the people, including the vulnerable, will fall. And this phenomenon where we know that all the population will eventually reach herd immunity, that is the point at which the rate of new infections is very, very stable. And this can be assisted by, but it's not dependent upon getting a vaccine. So this particular physician believes that the goal should be to, therefore, to minimize mortality and social harm until we can reach this herd immunity. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection while better protecting those who are at highest risk. So some of the measures to protect the vulnerable, that is the people who are, say, age 70 and greater, and a lot of those people are in nursing homes. So he gives us an example. The nursing home should use staff who have acquired immunity. They should do frequent testing for COVID of the staff and all visitors. And the staff rotation should be minimized so that you don't bring in somebody who might have the COVID infection. Retired people living at home should have groceries and other essentials delivered, and whenever possible, they should meet family members outside rather than inside. I'm going to talk a little bit about that in just a minute. And those people who are not vulnerable should be immediately allowed to resume life as normal. Simple hygiene measures such as hand washing, stay home when you're sick should be practiced by everyone anyway. So the idea of herd immunity should be better clarified. So even when we come up with a vaccine, which maybe, if you listen to the news, is going to happen, I'm going to share some of the most recent ones that I got like last week. There's an article that I read on a deficiency of glutathione is a predictor that those who do get COVID, who have low levels of glutathione, are at very high risk of dying. We're going to talk about glutathione in just a second here. There's another article that I got on vitamin D supplementation, which actually we have talked about in this group in the past, how important vitamin D supplementation is to help with your immune system and to fight against the COVID infection, reduce the risk of influenza, reduce the risk of death. There's other articles talking about different nutraceutical and botanical agents that are beneficial. There is, talking about glutathione, there is another supplement or another precursor called N-acetylcysteine or NAC. This supplement, this precursor, increases glutathione. Glutathione in our system is perhaps the most powerful antioxidant that the body makes. Antioxidants are very, very key toward killing the virus, toward mitigating the damage that the virus does cause. Because what we are learning now is that the virus, yes, the virus is very deadly, it's very bad, it causes a lot of problems. But what seems to ultimately kill people isn't so much the fact that there's a virus in your body, it's the fact that the body seems to have this, and it doesn't make a lot of sense, but it seems to have this exaggerated response to the virus. And this exaggerated response actually ends up killing the host more so than the virus would actually do so. So a lot of these supplements and a lot of these other things that we talk about are very, very useful to mitigate this exuberant response to the virus. So I just got another article that I shared with Tammy talking about melatonin. We know that melatonin is a hormone and we've been using it for our practice for bioidentical hormone replacement therapy. A lot of the research recently has shown that melatonin has some very profound and very, very significant effects against cancer, different kinds of cancers, pancreatic cancer, lung cancer, prostate cancer, breast cancer, colon cancer, and that if you have higher levels of melatonin in your system, it seems to be very, very protective against these cancers. And now there's this research coming out showing that melatonin is also extremely beneficial against COVID-19. Well, melatonin is something that we carry, something that we provide. I think it's something that is not really a good reason for people not to be on melatonin. Vitamin C has been used, and it's been well documented in the literature, been used in hospital ICUs to treat COVID-19 patients with really, really good success. We do the same thing here. We have high dose vitamin C bags that we can infuse to people who have COVID-19. Mm-hmm. One treatment, one infusion isn't going to clear the virus, but it starts, and after usually about maybe 3 or 4 of these infusions that we give intravenously, you can pretty much clear the virus out of your body. I mean, that's a pretty, a lot of the things that we do in medicine come with a lot of side effects and a lot of complications, and sometimes the cure is worse than the disease. But the things that we talk about here, that's never going to be the case. There's no harm in vitamin C, and there's a lot of benefit. There's no harm in melatonin, there's no harm in vitamin D3, but a lot of benefit to that. We've talked in the past about zinc also being a very important supplement. Mm-hmm. And in fact, what I'm going to do now is I'm going to So I'm going to hand out some of the various supplements that one can use to talk a little bit. A lot of these, the level of evidence maybe isn't all that great, but hey, what the heck? It could be, if it's useful, might as well. Oh, and yeah, Ruth, you have a copy too. There you go. I knew there was somebody in it. So when we talk about glutathione, first let me just show you. So this is from MedQuest, and I don't have any stock in MedQuest. I don't get anything from MedQuest, but MedQuest prepares a glutathione spray that you can spray onto your tongue. And it's the way this is formulated, it gets absorbed very, very rapidly. Get your glutathione levels up very, very quickly and very high. When people ask for it, we also have glutathione that we can give intravenously. So we all know what a Myers cocktail is. So a lot of people, if they need a little extra boost, because glutathione does not mix well with the other chemicals that are in a Myers, we have to give this as a separate, after the Myers is done, then we can give this as a push, afterwards. And it's a very fast way to also increase your levels of glutathione. Again, very, very potent antioxidant, probably the most potent one in the body. So, but we have all this stuff, so it can be given, as needed.
Does glutathione come in a pill formation, caplet, that you can take? You can't.
No,
okay.
This is the only way. Is
so
either this particular formulation where they have to actually attach it to a what they call a liposome, and it has, in order for it to be absorbed. There are no capsules or tablets that I'm aware of glutathione. It's either, most of the time, it was strictly just intravenous. And then lately, MedQuest has come up with this formulation that seems to.
So we could recommend the MedQuest formulation
Yeah.
to patients.
Absolutely.
Okay.
Yeah, absolutely.
Yeah.
Now, don't forget, glutathione is just one part of the puzzle.
Right.
It's like a diamond with many facets. There's a lot of parts to this. Glutathione is one part of it, but you can't just focus on this and then ignore
I know.
things like vitamin D and vitamin C and some of
Right.
these other things. So, the other thing that I want to stress to you guys, excuse me, before I get to that. So on this list that I just handed you guys, so they talk, some of the keys I think are vitamin D, vitamin C, zinc, melatonin, N-acetylcysteine, and glutathione, and then more at the bottom of this list is resveratrol. You guys know where you can get really good source of resveratrol? Anybody? A glass of red wine.
That's easy.
Some of these other supplements that are listed, I don't necessarily know much about them. I don't know how valuable or not valuable they are, but the ones that I do know about, I've mentioned to you guys. So, the other thing is there have been, I can't begin to say how many articles on specific hormones with the treatment and the prevention of COVID-19. The ones that are the most important are estrogen, estradiol in females, and testosterone in males. Those people who have high levels of either female estradiol and testosterone it's very, very rare they get the infection that they die. Very rare, okay? So what has not been looked at as much as estradiol and testosterone is thyroid. But thyroid has also been shown in earlier studies because of its influence and its benefit on metabolism. It seems to help also in terms of either clearing the virus or really don't know for certain the mechanism. They have studied the mechanism of estradiol and testosterone on the ACE2 receptor. Remember the ACE2, the ACE2 receptor on the cell is how the virus gets into the cell. So it's now been well documented how estradiol, testosterone affect that receptor. Vitamin D also affects that receptor. We think that thyroid will affect that receptor, but it hasn't been worked out as clearly, okay? So, one of the underlying themes about this whole thing is we're talking about your immune system. Because if you think about it, when you get a vaccine is not an antidote. If you get, say, a Staph aureus infection, penicillin is like, it can counter that, all right? So it can actually kill the Staph aureus bacterial infection. There are no conventional medicines that will kill a virus. A vaccine will only jumpstart your immune system. And the COVID vaccine is going to be very, very specific for the virus. So that part of your immune system will really get upregulated, and it can, be very, very beneficial to fight the virus. But there are no antivirals, conventionally speaking, that will kill the virus directly. What you have are these indirect means. So it's like, upregulating your immune system to be able to fight for you. Well, that's what all the hormones and the supplements are going to do anyways. They're going to make your immune system more powerful, just like a vaccine would. So in that line, some of the other things to think about, just from a general health perspective, if you're really worried about getting sick, you're worried about infection, really try to limit sugar. Sugar is absolutely known to depress your immune system. And that's the last thing you want, is to depress it. You want to make it very active. So sugar, be very, very careful and very discreet on sugar intake, okay? So anyway, talk a few more minutes on really what do we now think is the reason, the fomite theory, meaning if you cough or you spew particles, they'll go to a surface and somebody else will come along and touch it, and then they touch their face, and then that's how its spread. That's called fomite spread. That's this fomite theory, which still is, to a small extent, is still true. So because of the fomite theory, it's still recommended, and I firmly believe you should wash your hands, you should use hand sanitizer, you should spritz things around to try and kill surface contact so you can minimize fomite spread. But what I think is becoming more and more evident is the concept of aerosolization. So let me demonstrate a little bit. So what does that mean? So here, this is just the typical alcohol spray that all you guys should have been able to get at some point. So if do you see the little particles? So some of them, if they're big, they're gonna fall. The ones that are not big are gonna stay up there and they're gonna hang around for an indefinite period of time. So you couple that with, and let me, so actually I need a volunteer. Step up. So actually I want you to take your mask off because I need your, so stay 6 feet away and face the camera so that you can see. All right, so if I do this, now, let me do a little more. Do you smell it?
I don't smell.
Let me do a little closer.
Could be because I was sick too, but.
Well, I need somebody who
Yeah.
can smell. Maybe I should
No,
get
I can a little bit.
Okay.
Sure,
all right.
absolutely.
All right, now, what happens? Ventilation.
Mm-hmm. Oh, sure.
Can you smell it?
Yeah, I can. Mm-hmm. I mean, a little bit.
Do you smell it the same as when?
No, I don't.
This is a really
It's not.
hokey demonstration, but it's the best I could come up with in the last minute. So with the ventilation, and you do this, your aerosolization, it goes away. Thank you. You can sit down. So, why is this important? We know that the infection is going to be related to the amount of viruses that are in the aerosol. Okay, so a large amount versus not a large amount. Also, it's going to be related to how much time you're exposed to that. So if the cloud, the aerosol cloud is here, and you're here for an hour, then that's a lot different than if you just pass through it and are exposed for a second. So time and volume, I think, are very, very key toward how likely you are to get infected. So what I'm trying to demonstrate rather poorly is that if you have good ventilation, then a lot of the issues, they're going to be non-existent. So one of the things that I do, not only in my office do I spritz everything down every morning, but I have a fan on. So if you come talk to me, if you got the virus, the fan is going to blow all the viruses away from you. So I think, and because of that, I'm going to make a rather bold statement, and I'm going to state that I think if you have a bar or a restaurant that's got good ventilation, I don't see any reason why people can't go there. The problem with when they talk about all the infections that happen because people went to the bar, there's really not good ventilation if you think about it. It's pretty stuffy, very hot, and there's not good air circulation. I think if you could be in a situation where there's good ventilation, I don't think it's going to be an issue. And so I heard one of the things that was recommended, I think for the state of California for Thanksgiving, that they can only congregate outdoors. Well, that doesn't make a lot of sense. What if you are in the Sierras, it's freezing, but I think what they're missing is that I think outdoors is fine, but it's the fact that there's ventilation. If you could be indoors if you had good ventilation. I think the same positive benefits would also be seen, but you could be indoors. So I think that ventilation is very, very important. I think it's probably more important And I think that the aerosolization theory is probably the more prevalent theory now than the fomite theory. So, in conclusion, one thing else. So I go to a lot of the World Medical Conferences as I assist Dr. Rousier with the lectures and stuff. So I watch what he does because he seems to be a pretty intelligent gentleman. So when he lectures, his mask is off, but when he has a break and it sits down, he puts his mask on. So when people come, you know, it's some barrier against the viruses. But what he does also is interesting. He will do this. He will spritz his mask. Okay. And then you put your mask on, and now you not only have the antiviral effect of the alcohol, but it's also going to help make your mask more effective. Now, that is basically the end of the talk. If you guys have any questions? Because I know I've seen that now the numbers are going up, they're spiking. Some places it's like a phenomenon, I think, because I was just in Utah. There's, I can tell you about Utah. They're saying they've never seen so many cases ever. It's been just horrifying, the number of cases. So everybody's scared, and I can understand why you'd be scared.
Exactly.
So, but now that I've spoken a little bit, maybe I can reassure, if you have any questions. You guys have any questions?